Well, thank you very much, and good morning, everybody. I do wonder what I must have done in a previous life that I end up being given a slot speaking after Alv, and indeed the last speaker of the morning. I clearly was a very evil person in a previous life. That was inspiring, and I do feel that we're changing gear a little bit in talking what I'm going to talk about, but I hope there are some commonalities, at least, in what we can say. Those of you who listened to that very long, I thought you were going to cut it, Mr. Chairman. Introduction to my CV will have wondered why it is that somebody who is an economist, who works for an economic organisation, is so interested in Alzheimer's and dementia. And we have, in fact, been doing a lot of work on this topic at the OECD. I suppose the simplest answer would be to say that it is because Alzheimer's and dementia costs our economies so much, but in fact that's a slightly misleading reason. The real reason why we put so much effort into looking at dementia and policies for people with dementia is that it is our impression that probably this is the disease which receives the worst quality care of any major disease that there is in developed countries. So that means that if we can actually overcome some of these barriers to delivering better quality care for people with dementia, we can do it. If we can do it for people with dementia, we can do it more generally in our health systems and our social systems. And so to some extent, Alzheimer's, dementia is a particularly interesting case because we do it so badly. So what can we do to actually try and improve it? So let me start by first of all justifying why I say that I think dementia care is so poor. This is a fairly eclectic set of facts that comes from a mixture of England, Germany, Scotland, Australia, Canada, a couple of cross-country studies, and of course the Alcove study. And just running through this picture is horrible, it's awful. More than half of the people with a disease being undiagnosed should be unacceptable. People with dementia, only 1 in 3 of them leave the house more than once per week. Carers for people with dementia, 20% more likely themselves to have mental health problems. A third of those in care homes being given antipsychotics. Might wonder why. And then we get to things that are happening in hospitals. People who go to hospital for a reason not related to dementia, the costs of treating them are 3 times higher than for people without dementia, for a number of reasons. And what's more, a third of the people who go into hospital come out of hospital with reduced functional ability. And half of those people never actually recover their lost functional ability. That is a picture of general systemic failure to deliver care, appropriate levels of care. I'm not talking here about finding a cure or some great medical breakthrough. I'm talking about doing the things that we know that we should be doing better. And we're not doing them at the moment. So I could talk a lot about why that is the case, in particular for dementia. But I'm going to instead talk about something a little different, because here I said this is a fairly eclectic set of data from a fairly eclectic set of countries. We don't actually have the sort of cross-country data so we can do comparisons about how different countries are doing in the way that they treat people with dementia, in the way that we often do for other diseases. For cancer, for example, I can give you a pretty good set of comparisons about which countries are doing well in dealing with different sorts of cancer, both in terms of outcomes and in terms of process and patient experience. I can't do that with people with dementia. Hence, what I'm going to talk about today, and a lot of what we're doing at the OECD, is about trying to change that so that we can actually come up with ways of comparing countries and how they are doing in the way that they treat people with dementia. I think this is particularly important just a slight digression. Because, of course, at the moment we have a huge amount of international attention going on to dementia in general, much higher than it has been in the past, due to the G7, G8 initiative, World Dementia Council, the leadership of Prime Minister Cameron and the interest of Prime Minister Abe in Japan. We have a lot more attention going towards dementia than we have had in the past. And this won't last. At some point, the political attention will move on to another disease. That's just the nature of politics. We must make sure we come out of this this increased interest in dementia with some things that can enable us to improve dementia care in the future. And I believe one of the things that we should be pushing very hard is a much greater effort, a much greater agreement across countries to compare how they are doing in their dementia outcomes. What we would love to do is to be able to measure outcomes, so what actually is happening to people. That's the gold standard, and it's incredibly hard for people with dementia, for all diseases, but maybe particularly when we're talking about dementia. Even if we can't do that, however, at least we should be able to monitor the policies and strategies that countries adopt. You've already heard some of the description by Jeff on what's happening at the European level, which is a great improvement of what's been going on. And of course, we can extend that beyond Europe. So this chart just summarizes what's been going on internationally recently since the Prime Minister Cameron called the G8 at the time summit in 2013. The various global events that have been going on, OECD's come up with a couple of publications about dementia care, looking in particular at things like big data and how that might be helping in improving both care and cure for people with dementia. We've participated in the World Dementia Council and in the WHO conference, where we prepared with the WHO a framework, a joint framework for improving dementia care, or looking at dementia care across different countries. That's the activities that have been going on. I won't say anything more about that, but I will talk about the approach that we've been following to try and develop comparisons across countries so that we can try and hold countries to account for the quality of their dementia care. And we have a two-pronged approach. The first is the immediate, what we can do immediately, which is to really compare policy responses for dementia. And I'll say a little bit about what we're doing there, a systematic approach to mapping policies for dementia. But we also want to lay the foundation so that we can do what is possible for things like cancer in looking at the comparisons of outcomes in the future. That will be a much more long-term process. So let me do, quite briefly, a summary of what we're currently doing to compare policy responses. That's, I suppose, relatively complicated chart summarizing the 10 areas of the OECD WHO framework for mapping policies across countries. In each of these areas, our objective is to be able to find ways that we can systematically talk about what policies are relevant for that area, be it, for example, for people with early dementia, can we diagnose them? Well, that's the diagnosis stage. People with early dementia, are we supporting people in communities? Are we supporting their friends and carers appropriately right the way through to end of life? Also looking at issues around care coordination and the use of technologies. So in each of those areas, the idea is to identify a set of policies. So, for example, looking at the issue of early diagnosis, the possible policy approaches I've listed there that we might want to be looking at, which means for each country, we are trying to collect information on what's on the right-hand side of that chart. Is it a policy priority? How is that structured? Is there any attempts at the country level to measure the impacts on the implementation of these policies? and evidence on the effectiveness of the approach. We want to do that in each of those 10 areas. That already is pretty ambitious, and I should immediately at this stage say it wouldn't even be possible to think about doing this were it not for the continued support of the UK government for trying to push this at the international level and also provide funding to do this work. The harder area is to look at building for the future and think about what sort of indicators we might want to end up with to measure the quality of dementia care and outcomes of dementia care in the future. So moving away from just looking at policies, but actually looking at what happens to people. And at the moment, we have a very restricted set of indicators that there is a reasonable chance of developing. Quite a few countries can look at use of physical restraints for people with dementia, use of antipsychotics, and so on. It's not, I don't think anybody would think that that's an acceptable list of the outcomes that are going on for people with dementia. It's a very low base that we're working on. We can do a little bit better when you get onto long-term care. There's a few other, more generally, so people who have difficulties in functioning more generally, not just for dementia. There's a few more indicators, though even there's still a rather unimpressive list of indicators that we can look at across countries. Of course, there are barriers that we have to overcome if we're trying to measure the quality of dementia care. You know most of these, they're fairly obvious. It is inherently difficult to measure the quality of life for people with dementia, although it's somewhat easier to measure it, for example, the quality of life of carers, and that may be a more immediate win that we could go for. Certainly looking at diagnostic rates of diagnosis, stage of dementia at different diagnoses, we're not yet there in terms of having consistent tools and recording across countries. Avoidable admissions for people with dementia. Unfortunately, hospital records often don't record dementia as a reason for people being admitted to hospital. It's often a secondary diagnosis which may or may not be added, and certainly isn't added in a consistent way across countries. And place of death for people with dementia, are they dying in the way and place that they wish to die? We don't have a way of linking diagnoses of that dementia to death records. I could go on, and I'm sure you can add many other technical and cultural reasons why measuring dementia care is difficult. That doesn't mean we can't move in that direction. I think if you had gone back 20, 30 years in cancer, people would have come up with a similar list. You have to start addressing these issues. If they're difficult, so they're difficult. We just have to work painstakingly together in order to overcome these differences across countries. What we will be producing in the fairly short term is a detailed map of indicators of dementia policies and dementia outcomes that are currently being collected in the different countries, the OECD countries, the developed countries of the world. We will be getting agreement across countries to collect a small number of indicators of dementia care quality to be collected within the next few years. So this is, we had a reasonably positive response from countries when we first pushed them to do this, and so I'm confident we will get agreement on a small number of indicators relatively quickly, and then of course for those to be turned into real indicators, that means that data collection systems need to be changed within countries. So it will be a little while before we actually start seeing the fruits of that, but it looks as if we will be able to get those indicators. We will be working with countries in developing the new statistical information systems they'll need in order to be able to collect these sorts of indicators and making recommendations on how they can improve their data collection. That's very much a data-driven presentation because, of course, that's what I was asked to do in measuring performance in dementia care. And I do think it's the right approach at the moment, given where we are in the political cycle of great interest in dementia. Of course, the ultimate objective, I repeat, is in order to be able to have some sort of way of holding countries to account for the quality of their care for people with dementia. I repeat, I think dementia care is probably the major disease which has the worst quality of care at present. And that means that we have more scope if we can develop country-specific indicators to be able to hold countries to account in order to be able to improve the quality of care in the future, which is why I believe this data issue is so terribly, terribly important in thinking about dementia and Alzheimer's in particular. Thank you very much.